Hi guys, I am Sass. I'm a nurse practitioner at Peacock Pediatrics, and today I'm going to talk to you about the 4-month-old and the 4-month visit. So 4 months is a super fun age. Babies are really kind of growing into a personality and learning to laugh and smile and interact and roll. So it's a really fun age. We'll kind of start by talking about feeding the 4-month-old. So at 4 months, your baby's main nutrition should still be breast milk or formula. And we get a lot of questions at this age about whether you can start solids. And there's really no right or wrong answer. We like to start solids closer to the 6-month mark. Sometimes, around 5 months, your baby may be showing signs of wanting to start, or you may be kind of interested in starting a rice cereal or rice kind of oatmeal mixed with some water, formula, breast milk, whatever you want to do. And if your baby's able to hold their head up in a high chair and lean forward and have really good head control, and they're not pushing the food out with their tongue, they may be ready to kind of start playing with some rice cereal. Your baby should be eating or getting bottles around like 5 times a day. At this age, they are no longer needing nighttime calories. So if your baby is still waking up for like a 2 a.m. feed, trying to push that out a little bit longer. And when your baby cries in the middle of the night, you can go in and give them a binky and kind of reassure them, because most of their calories are going to be getting in during the day. So you may have to, if they're not eating enough during the day, you can offer them another bottle to see if you can kind of wean out of that nighttime feeding. Next, I want to talk to you about some safety tips for the 4-month-old. So at this age, they do start rolling. They should be rolling both ways, or learning to roll frontwards and backwards, from their belly to their back and their back to their belly. And so at this point, when they are able to roll from their back to their belly, we do want to stop swaddling them. We'll probably have brought this up to you at their 2-month visit, but once they do start rolling, the swaddles are done. It is unsafe if a baby were to roll swaddled to their stomach, then they wouldn't be able to roll backwards, and that's not safe. So cutting out the swaddles, they should still be on their own sleep surface, without any bumper pads, blankies, stuffed animals in the crib with them. If your baby does roll to their stomach in the middle of the night, that's okay as long as they rolled themselves there. You don't have to go every time and roll them back to their back, but you should always be laying them down on their back to sleep. Keeping small objects away from the baby, so they're going to be curious and putting everything in their mouth. So keeping the little objects that they can choke on away, also plastic bags, making sure that older siblings are aware that they can't give those things to the baby. Your water heater, so for baths, it's really important to, you're feeling the water every time before you put the baby in, but also making sure your water heater is set to no greater than 120 degrees Fahrenheit. That way there isn't a chance that the baby could get scalded by the water. Never leaving your baby alone in the water, even if they're in some type of ring or a baby bath. Making sure you're prepared for the bath, so having the towel next to you, the soap, all those things right there, so you're not having to get up and leave. Never ever leave your baby in a bathtub or any water alone. At this age also, because they can roll, you should not leave them on any surface, especially high up, so not the couch, nothing without you standing right there or having a hand on them to make sure they don't roll off. Let's see, so playtime at this age group, we're still really wanting them to do tummy time, even if they're just constantly rolling out of tummy time, just kind of putting them back on their belly to help strengthen their neck and shoulder muscles, and get really good head control. It also, with them rolling, kind of gets all their muscles a little bit stronger. We want you to hold your baby and talk to your baby. at this age, they'll kind of, start making sounds, but having you talk to them and read to them is, their developmental language skills are already developing. So reading to them is a really great way to help those skills develop. And it's also really good for bonding with you and baby. Teeth we kind of get asked about when teeth can come. So, anytime from, around 6 months of age up to past a year, they may get their first tooth, and safe things that you can do for teething. So no Motrin before 6 months of age. They can have Tylenol if you're concerned about them having discomfort. Cold wash rags on the teeth and having them be able to gnaw on the cold wash rag is good. If you have any questions about things you want to use, there isn't a lot over the counter that we would want you to use, but if you have a question, just call and ask. We'd be happy to kind of walk you through it. And at your next visit, so your baby will get vaccines at this 4-month visit, and we'll also kind of talk to you about things to anticipate at the 6-month visit, which is when we will see you back. But if you need anything before that, just let us know.